think about, is it in the patient's best interest to make as many eggs as possible? So having now done mini stimulation IVF and natural cycle IVF for over 5 years, we started to look at the biopsy results of patients that are doing minimal stimulation IVF or natural cycle IVF and comparing those results to patients that have conventional or standard IVF testing. So to be clear, standard or conventional IVF testing requires birth control pills initially to help cycle the patient, then often using a medication called Dourron to essentially shut down the signal from the brain to the ovaries, and then at a high dose giving lots of medication to try to make as many eggs as you can, knowing that the egg quality won't be as high, but hopefully the quantity will prevail. And you compare that to minimal stimulation IVF, which is not using birth control pills or Dourron to regulate or down-regulate the patient, and then essentially working with the patient's own menstrual cycle. On day 2 or 3 of a menstrual cycle, we evaluate by ultrasound the ovaries, look at the antral follicle count. We measure the FSH and estradiol on that day, which is predictive of how results will go with that cycle. And then we can tailor make a stimulation protocol that often includes oral medication like clomiphene citrate or letrozole, combined with a small dose of injectable fertility medication, often given every other day. The goal of treatment is to produce 6 or 8 quality eggs compared to 20 or 30 eggs with conventional IVF. And what we see in the laboratory is that the egg quality tends to be higher, the fertilization rate is higher, and the subsequent embryo quality is higher.